Hi everyone, welcome to this evening's Facebook Live Q&A session. My name is Sonia. I'm one of the breast cancer nurses here at Breast Cancer Now, and I'm joined by Sally, one of our other breast care nurses here. And together we will be answering any questions that you have for us this evening. But before we do that, just a couple of housekeeping points. So just a reminder that this is a live session. It's not a confidential space. It will also be recorded. And so if you have any questions of a sensitive nature, you may prefer to give us a call on our helpline on 0800 800 6000. And we're open Monday to Friday, 9 a.m. till 4 and Saturday mornings till 1 p.m. Or alternatively, you can email us via our Ask Our Nurse service at nurse@breastcancernow.org, both confidential spaces, and we have the time to go through your individual situations with you. Otherwise, please feel free to pop in any questions that you have. We will try to answer as many as we can this evening. Any that we don't get the time to answer, we will provide you with a written response over the next few days. So just keep an eye out in the comment section below. As always, we will link a survey in the comments, so we would be grateful if you could take the time to complete that. All feedback is welcome, and it will allow us to tailor these sessions for you and help improve these sessions for you going forward. And so I think that's about it. So we'll go ahead with some of the questions that you have already sent in. Sally, did you want to
Yeah,
go through
hi.
any?
Yeah, hi Sonia. Hi everyone
Hi,
that's
Sally.
watching. So yeah, Sonia, one of the first questions we've had, what we know through the work that we do at Breast Cancer Now is the treatment of breast cancer is, whilst it's underpinned by guidance and
Mhm.
research and evidence base, we know that people's treatment pathways are then individualized to them, and so we know that people can have similar treatments, but sometimes in kind of different or in a different order, if you like. And so, one of the questions that's come through is from someone called Susie, and
Yeah.
she said she's asking what should she consider when she's looking at the surgery options after chemotherapy, and that's very often
Okay.
described as kind of neoadjuvant chemotherapy.
Yes.
And so yeah, so
Yeah.
be really helpful to I'm sure lots of people the answer to this question.
Yeah. Thank you, Susie, for asking that question. And so I think there's perhaps a few things that we could mention when answering this question, but generally speaking, when you are given, as Sally mentioned, neoadjuvant chemotherapy, your treatment team would have spoken to you about the potential surgical options that may be suitable for you after you've completed your chemotherapy treatment. And so it may be worthwhile if you don't have an appointment, just to contact your breast care nurse or your treatment team so that they can go through your surgical options now that you have completed your chemotherapy treatment. There are a number of factors that would help to determine what would be most appropriate or suitable for you. One of them being your response to the chemotherapy. And so, again, hopefully, your treatment team would have given you an idea as to your response sort of midway and upon completion of chemotherapy. And they should give you an idea as to whether you're looking at breast conserving surgery, or a mastectomy, which would involve removing all of the breast tissue. And so, if that hasn't already been done, as mentioned, it might just be a good idea to contact them. And so, if another factor that's taken into consideration when looking at your surgical options would be, the size of your breast in comparison to the size of the tumor, the cancer. And so, if your surgeons feel that you are amenable to breast conserving surgery with a good aesthetic outcome, then they will have a conversation about breast conserving surgery with you. Otherwise, it would be a mastectomy, and then with a mastectomy, we can have a whole other conversation about having a simple mastectomy or having a mastectomy alongside an immediate reconstruction, or a delayed reconstruction, and what that reconstruction looks like for you. It could be using an implant, or it could be using your own tissue, your own body tissue. But I think, Sally, it's as you mentioned, in that it is very much so tailorized to you, and what would be the most appropriate option for you, and equally what you would prefer as well. And so, that is something that your treatment team will talk through in depth with you. They will tell you what they think is the best option for you, and will also work with you as to what you feel would be your preference as well, and if that would be a suitable option.
Yeah, and I guess to kind of add to that, Sonia, is, what we hear a lot through the work that we do is, that time at diagnosis, you're trying to
Mm,
take in lots of information and,
yeah,
thinking about a treatment pathway. And for some people, everyone's information needs are different, and nothing's right or wrong. But for
mm,
some people, it's wanting to kind of know an outline of the whole pathway. Some people are
yeah,
take me through one step at a time. So it
yeah,
is very individualized to the person. And so I guess, it's filling any information gaps that you might have, and that's absolutely
mm,
fine to not remember everything all in one go, because it is a lot
mm,
to take in. And I guess after that chemotherapy treatment, it's thinking about the discussion, as you said, that you had at the beginning, but also thinking about the response, your cancer has had to that treatment, and
yeah,
does that change any of that decision making? Does it confirm that decision making? So,
yeah,
yeah, I think that kind of open communication with your treatment team,
mm,
and sometimes before you go into those consultations, they're for you. I was, when I worked in clinical practice, would say to patients, those consultations are for you.
yeah,
And it's about you getting as much as you need from those. So sometimes writing down any questions before you go, and actually,
yeah,
checking with your team, is okay if I ask these first, because these might, answer anything that you're going to tell me, or can I ask my
mm,
questions once we've had a conversation about,
yeah,
where we are now. So,
good point.
yeah, and I think, if you want to call us, and us kind of help you formulate what questions to kind of ask, and how to
Yes,
ask
yeah,
them, and that kind of thing, that they're the kind of conversation we have all the time, aren't they, on the helpline
definitely.
and through our written response service.
Yeah, absolutely. And I think, Susie, when when you do have that conversation with your team and you have a better understanding of what your options will be, you can, as Sally mentioned, give us a call on the helpline, and we have a someone like me service where we can perhaps pair you up with somebody who has already had the type of surgery that you are planning to have, and that might give you better insight as to what that will entail. Um, and sort of help manage your expectations as well, and for that.
Yeah, and we've had a question come through from Rachel,
Mm.
just kind of on that subject of, surgical treatment for breast cancer, just asking,
Yeah.
if it's normal for to have some pain, for things to hurt after a, this in Rachel's instance, a double mastectomy and reconstruction.
Yeah, thank you, Rachel, for that question. And yeah, absolutely. I think it is expected, and it's not uncommon to experience pain and discomfort, especially immediately having had surgery. Your treatment team should have hopefully given you some pain relief, which can, simple pain relief that can usually manage any pain or discomfort that you're in. And it can take a number of weeks. This, of course, varies for each individual, but it does take a number of weeks for that pain and discomfort to settle. But it goes without saying in that if you are in quite a lot of pain and discomfort, then do reach out to your breast care nurse and or your team, and they can assess the situation. And it may be that they prescribe you something a bit stronger to help with that pain. And it could be that they talk you through simple exercises to do as well that can help with any discomfort that you're experiencing. But it's not uncommon to experience pain and discomfort after you've had a mastectomy and reconstruction, which is quite a big surgery. So yeah, I think it's quite normal to be experiencing that.
Yeah, and often, excuse me, in depending on where someone is in that pathway, because there might be people that are watching that are waiting surgery. And I think as part of that kind of pre-operative, so that pre-surgery assessment, it's what's your baseline, what's normal for you. Are you someone, because sometimes people might have other underlying health conditions, and it's just being aware of kind of what's the baseline, um, and also what you're concerned about, because sometimes it's the fear and the uncertainty of what's going to happen. And whilst that's difficult to accurately predict, I think talking those things through, what to possibly, expect, what we know from, lots of people that have similar treatments, but also, we would just reinforce, always speak up. Don't feel that, this is expected, so I've just got to get on with things.
Yeah,
It really is getting that help and support, in whatever way. And, as you quite rightly say, it can be, you know, sometimes it can be how you position your arm and the use of cushions and pillows. Sometimes it is medication. It can be a
Yeah,
load of, there can be lots of different kind of interventions that can make someone more comfortable after surgery. But yeah, I guess what we'd say is do reach out to ask to your treatment team, your GP, if you have got any kind of discomfort or pain, or
yeah,
however you would define it after breast surgery. So
yeah.
yeah,
Okay.
and we've got lots of information on our website,
Yeah,
and we're sure we know that the treatment teams working in the NHS and the private sector use our information as part of that kind of package. So it's that kind of collaboration so that we're making that information as relevant as possible for people. But again, yeah, don't hesitate to call us or email us, or ask questions in this way as well.
yeah.
Um,
Thanks, Sally.
we've talked about kind of chemotherapy very briefly, but we've talked about surgery after chemotherapy, but obviously other treatments for breast cancer. Some questions coming through are around some hormonal therapies, and we've had one question around tamoxifen. This is from Debbie, and I'm experiencing hot flushes because of tamoxifen. Kind of, what can I do?
Yeah. Yeah, thank you for that question, Debbie. And it's we hear from many people who are on tamoxifen and other hormone therapy treatment that do experience menopausal type side effects, like hot flushes. So you're not alone in experiencing that. But thankfully, I think that there are a number of things that you can do to help manage the hot flushes. I think so. Firstly, you don't mention how long you've been on the tamoxifen for. However, what we do know is that the longer, in most cases, that you are on, in this case tamoxifen, the longer that you are on it, the symptoms, the side effects that you're experiencing do lessen over time. And so it could be that the longer you are on tamoxifen, hopefully the hot flushes that you're experiencing are not as persistent. It may be worthwhile contacting your treatment team just to make them aware of the side effects that you're experiencing, because ultimately, if it is debilitating and it is impacting your quality of life, then that is something that they need to look into. But with hot flushes, there are simple things that you could do, which could be, looking at, for instance, your diet. We know that, cutting back on, if you're somebody that drinks coffee, if eat spicy food, for instance, cutting back on things like that can help. Wearing loose clothing, cotton clothing, maintaining a cool room temperature, using breathable bedding, for instance, can help also to manage any hot flushes or night sweats that you're experiencing. Going back to sort of keeping your body cool, so breathable fabrics, using fans, ice packs. But if you've tried all of those things and it's not helping, again, reaching out to your team, because it could be that they can talk you through complementary therapies. We know that acupuncture, hypnosis, for instance, can help reduce the frequency and severity of hot flushes. It could be that they tell you to try changing the brand, and so you could speak to your pharmacist about that. For most women that are on tamoxifen, changing the brand is a game changer. Sometimes it is a bit of trial and error, finding what brand suits you, and then continuing on that brand. It could be that you change the time at which you're taking it. So instead of the evenings, for instance, you try taking it in the mornings. But then equally, there are medications that your team can prescribe. And so we know that antidepressants, like venlafaxine, citalopram, can help manage hot flushes. But then there are, gabapentin, clonidine, so drugs that have multi-purpose that can also be prescribed for hot flushes. But equally, I think give us a call and we can talk you through it. We have great publications on menopause and breast cancer that you may find helpful to read. It could be that you ask your team about a referral to a menopause specialist, but I think the point is that there are a number of things that can be done. I don't know if you would like to add to that, Sally.
Yeah, I mean, there's some other questions coming through actually
Yeah,
around side effects to hormonal therapies, so kind of aching, but
yeah,
also someone talking about aching after chemotherapy as well. So, going back to the hormonal therapies, we know that kind of that aching or joint pains can be a side effect to those medications. And we
Yeah.
know, after treatments like chemotherapy, people can, I think it's described as feeling like they've constantly run a marathon. And I think we know these can be effects to treatments. I guess the other thing always to say is to also let your treatment team know, because again, have you got other underlying health conditions? What is actually the underlying cause of someone's kind of, that someone talks about leg cramps. It's it is talking to your treatment team. It's looking at the kind of side effect profile. We've got lots of health information on our website around the kind of hormonal therapies in general, the specific drugs, letrozole, tamoxifen, and
Yeah.
anastrozole, and so you can see that they can be, side effects, and we talk around, whether they're common or less common side effects. But so all that information is there, but I guess it's about reporting those, because very often there are things that can be done, but also, as I said, ruling out anything else related to, because we know, other conditions can cause similar symptoms as well. So
Yeah.
I
Absolutely.
would, again, as we've kind of reinforced, more than happy for you to ring the helpline with these kind of questions, our email service, but also your treatment team. And as I said, our kind of website has lots of information around that. Um, uh, there is a question. Martine's asking
Yeah.
about bras,
Mhm.
and kind of what are the best kind of bras and things to wear after surgery.
Yeah. Thank you, Martine. Yeah, that's a great question, and it's always good, I think, post surgery to be wearing something that is giving you the support that you need. I think in terms of, what the best supportive bra would be is something that would be front opening potentially, so that you don't have to, um, have the effort of kind of closing it from the back, but also something that's non-wired but is giving you the support that you need. So essentially a non-wired supportive bra. Sports bras can be good as well, but there are some great brands out there that do offer post-surgical bras. So we know, for instance, Asda, Primark, M&S do great bras for women like yourself who've had breast surgery, and what they can also do is measure you, so that you have something that is obviously the right size and is giving you the support that you need. But
Yeah,
again, oh, sorry, Sally, go on.
no, I was just going to say, I think, Martin mentions being a runner as well, and I think,
Yeah,
um, it's going through that kind of transition of, which bras are, a best kind of initially post surgery, and then again, people are very individualized, and some people's the kind of the transition between one bra to another and going back to maybe bras they wore before or trying new
yeah,
things, I think can be different for everyone. So we've got lots of information on our website around, how
yeah,
to fit a bra, how to kind of measure, who to go to, but
yeah,
also, as you say, those kind of post surgical kind of signposting of where, we know that um, bras have actually been designed in mind for people that have
yeah,
had surgery. And then I think, I completely appreciate, it's difficult to keep changing and switching bras. So the other thing is, speak to your breast care nurse, because they may have, bras that other patients have recommended and people may
yeah,
want to try. So I think it can just be, trying what's comfortable for you
yeah,
with some of those principles that you mentioned, that we know that kind of soft supportive bra, but not with wires. Sometimes front
yeah,
opening works for some people and not others. So
yeah,
yeah, we've got lots of information about bras, bra fitting, and signposts of really places that really have taken on board the impact of women that have had treatment for breast cancer, and what a bra, what they might need in a bra to make that more helpful for them after any kind of treatment. Yeah.
thanks, Sally.
Um, a question, also, something that we hear a lot on the helpline, and through the work that we do, is really around after treatment and that kind
Yeah,
of fear of recurrence. And there has been questions around, treatments like letrozole and
yeah,
the risk of recurrence. So obviously we talked about people's individualized treatment plans and people having those treatments to treat their cancer and reduce the risk of the cancer coming back. And again, those are discussions to have with your treatment team around, what is the best treatment for you. I guess those feelings around recurrence are quite common, aren't they, Sonia?
Absolutely, yeah. And I think it's completely understandable. As you said, it's such a common feeling. And most people that we do speak to who've completed their treatment for primary breast cancer are worried about the breast cancer coming back. And and I think in I suppose the main concerns that people have is, well, how can we manage our risk to prevent a breast cancer from coming back? It is very much so individualized, as you mentioned, Sally, and risk varies dependent on your individual situation to have a breast cancer that you had. And so your treatment team will talk you through your individual risk if that's something that you would like to know about. But the treatment that you've had for breast cancer, it not only treats the cancer, but it helps to minimize and reduce the risk of it coming back. But going forward, your treatment team will talk through your follow up with you and what they plan to do in order to help manage your risk as well. And so, it's always a good idea to speak to them about your fears and your worries. That could be with your oncologist, with your breast care nurse, and you can have a conversation with them about how the treatment that you've had so far has help to minimize that risk, and what the treatment options are if it were to come back. If a scenario where you did have a breast cancer recurrence, what type of treatment would you be looking at? It's important that you do speak to people, as mentioned, so speaking to your friends and family as well about how you're feeling. We have a great service here at Breast Cancer Now, our moving forward service, which is tailored to individuals who've completed, treatment for primary breast cancer, and it does explore these thoughts and feelings and the fears that one does have post completion, and it allows you to have supportive and open conversations. It's a confidential space, and you can connect with others who've also had a lived experience. They will understand how you're feeling, and ultimately it will give you the tools that you need to feel more supported, more in control and confident, so that you are able to understand your risk and how you're managing that, but also able to move on with your life, post a breast cancer diagnosis. Um, and
Yeah.
I don't, yeah, how do you feel about that, Sally? Is there anything to add to that?
Yeah, no, I think you've covered that really well. I think it is, for some people they find that those kind of feelings and those fears, become less, but for others, um, not so much. But I think through the work that we do find that over time it is just about finding ways to kind of cope with those feelings and getting support for those feelings. And we're always more than happy to kind of talk that through on our helpline, or you know the written response service that we do, and as you say, all of those kind of support services that we offer, to try and address that for kind of individuals.
Mm,
I was just on the on the questions coming through. There was more of a comment from Darren, and
mm,
Darren talks about things help for men. Darren, you don't specifically say whether you're affected by breast cancer, or yourself, or but that's a kind of maybe a presumption I'm making. But we do breast cancer now. We are here to support anyone affected by breast cancer,
absolutely.
and all of the things we've talked about in terms of side effects to treatments, and post surgical changes, that all of those answers are relevant to anyone having treatment. We do acknowledge that less men are diagnosed with breast cancer, and that can sometimes feel quite isolating. What we know, that
Yeah.
mental feeling kind of isolated. But certainly, breast cancer now, we've got some health information specifically for men, with some great video content of of someone with a lived experience, really talking about the impact for them. And there is a men's virtual meetup group as part of that support process for men. So, as I said, I'm not sure if that specifically answers your your comment, Darren. But we're here to support anyone affected by breast cancer. That also talks to any kind of partners, friends, family, children of those affected by breast cancer, because we know Sonia, through the work that we do, that the impact of breast cancer can be quite wide ranging in someone's life. You know, they don't leave their life behind when they're experiencing breast cancer, and we're here to support anyone affected by breast cancer.
Yeah, absolutely.
Yeah.
And Sally, I think this might be a good point just to remind everybody about the survey that I mentioned earlier on.
Yeah.
If you've got the time to complete that, that would be great.
Yeah, because I think what we want to do is to meet people's needs. So
Yeah,
if there is an area that you feel that you want us to specifically concentrate on, or
yeah,
kind of support that meets people's specific needs, or anything we can change, then that's what we're here for, and that's what we want to do, is that kind of continuous development of our services so that we're meeting people's needs. And that lived experience of anyone watching this that's affected by breast cancer in any of those ways I've mentioned. Everyone's opinion and voice is as valid as another's, and we want to take all of that on board. So yeah, do let us know. There have been some questions coming through. I think we've talked a bit around there seems to be some questions kind of around kind of physical activity after breast cancer treatments. I don't know if you wanted to talk a bit about
Mhm.
that, how that can sometimes impact on people after treatments.
Yeah, absolutely. And I think again, it is very much so individualized, isn't it? I think the level, the degree to how much physical activity you can do, and also dependent on, the treatment that you've had, because we know that, certain treatment for breast cancer can limit, the amount of physical activity that you can do, or perhaps what your baseline was prior to breast cancer treatment and what it is now. It can absolutely be challenging, but we know that physical activity sorry, can help not only manage a lot of the side effects that we touched upon earlier that you can experience from breast cancer treatment, but it also minimizes the risk of a recurrence. And by physical activity, it's important that you find something that it works for you, that's suitable for you, and it doesn't necessarily mean that you have to do something vigorous or exerting yourself. It could just be going for a walk, and moving your body. It's always a good idea that if you wanted to take on a new activity, for instance, just to speak to your team, so communicating with them about anything that you would like to do, and they can talk you through whether they think it's appropriate, dependent on what stage you are at, whether you're in active treatment or you've completed treatment, and they can perhaps talk you through how to ease yourself into it, so that you're not overexerting yourself. But you can always give us a call on our helpline, or write into us, so that we can talk through your individual situation, and can give you a bit more information about the benefits of physical activity. But
Yeah,
it's sorry, Sally.
yeah, no, and I was just going to say, and some of those longer term impacts as well, because some of the comments coming through
Yeah,
are around, people that have got kind of longer term impacts, whether that's on kind of physical activity, whether that's on, a persistent discomfort at the site
yeah,
of someone's surgery. And I think, it's important to say that you may feel that you get lots of information and support at the beginning, when you're diagnosed and your pathway, and then you know some people will be having things like open access follow-ups. So
yeah,
once they've completed their hospital-based treatment, they won't necessarily be seeing their treatment team on a regular basis. They may still be having kind of mammograms, dependent on the type of surgery that they've had as their treatment. But there's people can contact us and their treatment teams for the years beyond their diagnosis and their treatment. So and also your GP is there as well. So again, like I've reinforced earlier, please don't suffer in silence, have these kind of
yeah,
concerns. Is this normal? Is this not normal? Or it's 2 years down the line, should I be talking about this now? And it's a definite yes. If you've got any concerns,
mm,
then it is about talking about those, getting those heard, and making
yeah,
those assessments, whether it's related to long-term effects of treatments, or, as we've said before, it's also important getting checked out for anything else going on, because people do have other illnesses and things like
yeah,
that following a breast cancer diagnosis. So that isn't to worry people, but it is just important, I think, to get those things checked out. But you
You
know,
can,
we're more than happy for people to call us on the helpline, or through our written response service to kind of ask us those questions, because sometimes people just, you know, want to feel kind of empowered to have those conversations and ask those questions. And
yeah,
that's, you know, again, that's what we're here for. So um, people have been asking again around other types of treatment. So another one is radiotherapy,
yeah,
and someone asked kind of earlier back in the kind of questions about how radiotherapy works, and someone else has
yeah,
obviously had radiotherapy and is talking about Yvonne's skin changes.
yeah.
That's quite common with radiotherapy, isn't it,
Yeah,
Sonia?
absolutely. Yeah. And so, yeah, I think it's, as you said, Sally, one of the most common side effects associated with radiotherapy would be skin changes. So it's localized treatment. And so, notably the skin changes would be the breast, chest area, axilla, up to your collarbone. And usually it does improve time. And so, immediately after you've completed radiotherapy or during radiotherapy, it would probably be, you know, quite apparent, it may feel quite hot, quite angry looking, and very uncomfortable. But hopefully, what your treatment team will have spoken to you about prior to starting, and during, and if you are experiencing any skin changes, talk you through creams, moisturizers that you could use to help, wearing loose fitting clothing. But as mentioned, it is something that should hopefully settle over time. But if it's something that you're worried about, or if it's something that's causing you quite a lot of discomfort, then it's always a good idea to flag it to your breast care nurse, your radiotherapy team, so that they can assess, and advise accordingly. But yeah, it's quite common, and it's something that we do hear quite a lot about on our helpline and Ask Our Nurse service. People who've completed radiotherapy treatment, and are experiencing skin changes. I suppose it's not uncommon to have longer term side effects with regard to the skin, in that you could notice that the area that has been treated is slightly darker than the rest of your skin, and for some people that could be a permanent change, or quite a long term sort of a long term change, in that it could take a while to settle if it does. But yeah, any immediate skin reactions that you're noting, moisturizers are usually recommended or suggested, wearing loose fitting clothing, but yeah, flagging it with your team, and letting them know.
Yeah, and the same as where you all have kind of different skin in life. Some people have more greasy skin, some people have drier
Yeah,
skin, some people find that they can sit in the sun and don't burn, you know, in normal, you know, and so people's kind of impact of kind of changes of their skin can be different. So again, it's about what's your baseline, and then um, you know, you can't necessarily predict what kind of skin reaction you're going to have, but I think it is just really important to get that checked out, and but just remember that it can be different for different people, but it is important to, because it's important for the team to see that and to monitor that, but also treat it and offer support, as you say. And often, you know, that can be moisturizers, but for some people, it just really depends on the reaction that they've had. So again, you know, if someone's about to start radiotherapy, if you're concerned that you have a certain skin type, you know, make sure you say that to the team, and ask them if they, you know, if they think that you know, that you can then make contact if you're concerned that the skin has changed after radiotherapy. And
yeah,
again, I would just reinforce, as we said all along, you know, if people have those longer term changes and effects, it is about reporting those. If you've got any concerns to your treatment team, to
yeah,
you can, you know, call us to talk about that as well.
yeah,
Yeah.
absolutely.
Um, People are talking about, there's lots of comments around kind of the sequencing of their treatments, and again, we kind of approached that a little bit at the beginning of the Facebook Live, that, you know, everyone's pathway is kind of individualized to them, but it's, you know,
Yeah,
it's understandable when people are saying, you know, I've had chemotherapy and then I'm going to have surgery and reconstruction, or I've had my surgery, you know, what comes next? Hormonal therapy or radiotherapy, or can they, you know, it can be different for everyone, can't it, Sonia?
yeah. And I think it's
Yeah.
difficult, isn't it, when you're looking online, or listening to other people's experiences, comparing your own. But there isn't, one set pathway for everybody. Thankfully now treatment is tailorized, and so it is very much so based on your individual situation, what would be safe for you to have, and what would be most appropriate in treating your breast cancer. And hopefully it's, again, as you mentioned, Sally, in that, when you're having your initial consultations with your team, it's completely understandable that you won't take in all the information that's given to you, and your treatment team will understand that. And what they will do at each point, of your treatment journey, is talk through, why they're offering that treatment to you, what benefit you will have, and how it's hopefully aiming to reduce the risk of a recurrence. But you don't have to necessarily wait until your appointments to address any questions that you have. So it is just reiterating what we've said, in that do reach out to your team, and they can talk through your individual situation. They will have all of your images, your reports on hand, and so they can answer your questions, and they can talk you through why you're having certain treatments before others, and why your treatment pathway may look different to other people's. And I think knowing that and having that information in itself can help you to better understand the situation, and help you to better prepare for it as well.
Yeah, and I go back to my point in the beginning that sometimes, trying to take all of that information on
Mm,
board can be really challenging because
yeah,
you've just got so much going on, and your, your information needs can change because sometimes, like I said, some people want to take all of that information in the beginning, or other people
yeah,
just want the chunk and check as they go along. And
yeah,
as I said, that there is no right or wrong. I suppose what I'd also reinforce, through the work that we do, and when we all worked in clinical practice, it's okay to keep to say, could you just go through that with me
yeah,
again? Because it is just so much to take in, and that's,
yeah,
that's what we're here for, and that's what treatment teams are there for. It's to, is to go through that and to explain the decision making process as to why things are sequenced in a certain way, and the different kind of timings, and processes for treatment. So yeah, definitely keep asking if,
yeah,
because it's just so much, and some of it's just such complex information to take in, and you know that's why we produce the information that we produce, and and do all the work that we do,
yeah,
to complement the care of kind of NHS teams as well.
yeah. Sorry.
And I guess I just wanted to just go back to a point around, we were talking about skin changes and stuff. We're not obviously skin specialists, but I would just say, we would always advocate good kind of skin care. Obviously, we're a breast cancer charity, but, there's lots of advice on, things like the NHS website about, protecting your skin and the risks of, you know, other conditions related to the skin and things as well. So we'd obviously, we're healthcare professionals, always kind of advocating, good skin health, as well as, the work that we do around breast cancer.
Yeah, thank you for
Okay.
adding that, Bunny.
I think we're nearly ending our
Yeah,
our time here.
yeah,
We hope that some of those answers will can kind of, there are some other questions around kind of side effects of, hormonal therapies, and the sequencing of treatments and things. And as we said, we will answer, people's questions, tomorrow.
yeah,
But also, we hope that some of the answers, have been wide enough to kind of answer more than one person's, question or concern. And we can't reinforce enough, there is lots of information on our website around, the specific treatments, the specific drugs for both chemotherapy, hormone therapy, but also the impact of breast cancer as well. So that physical impact, things like bras, things like, pain or discomfort, but also that emotional or psychological impact. So that fear of recurrence, uh, the impact on, feeling isolated if you're having a treatment and you don't see others, that you feel that you can relate to and have that kind of peer support as well. And you mentioned earlier that we have lots of services where there's someone like me where we can match someone with someone that's had a similar experience, so that they can kind of talk you through the kind of things that they went through and things that they found helpful. You've mentioned our moving forward course, so that's for people that have completed their hospital based treatments. And that's about, that what it says on the tin, the kind of moving
Yeah.
forward, following those treatments. The other thing to say is, there are people on here that have talked about starting chemotherapy or radiotherapy. We have our forum where we have, specific areas on that forum where people will be at exactly the same part of your pathway, or
Yeah.
people that maybe have experienced that part of the pathway and they really want to offer you that peer support of how that was for them. So yeah, the forum's also a really good place.
Definitely. Thank you, Sally. And I think, yeah, just as we're closing, I think it's just a reminder of our survey. If you have the time to please complete that. Any questions that you have posted that we haven't had the time to answer this evening, we will get back to you with written responses. So just keep an eye out in the comments section. Our next Facebook Live session will be next week, Thursday, the 5th of June, where our colleague Katie will be joined by Claire O'Donnell from Make Seconds Count. So make sure to tune in to that session. And just a reminder of our helpline service. It's open Monday to Friday from 9 a.m. till 4, Saturdays till 1 p.m. and our Ask Our Nurse service. So you can please email in to us with any questions that you have, and we will provide you with written responses. But yeah, thank you so much everyone for tuning in this evening. Um, and yeah, I think we'll leave it at that. Thank you, and I hope you have a lovely evening. Take care, everyone.
Bye.